Okay, welcome. If you're watching this video, it is because you are within the first 2 weeks of status post hip, knee, or ankle, and you have either been evaluated by me and movement is indicated, or you have clearance from your doctor or your healthcare practitioners, and you can start doing this, supplementing, getting higher levels of fluid, blood flow, and the healing will happen with better expectation, with better results. Let's get started with you. Are winning the day in the morning. You're going to move your toes towards your knees. This will activate the anterior part of your leg. This will definitely start getting your quadriceps above your knee to fire, to activate. This is specifically hard in the first week, but this is the dividends, the investment we need so that you can grow to higher functional mobility towards bigger movements. Take a deep breath. Do between 5 to 10 repetitions. The next video will illustrate how the ankle circles. You can start clockwise. You can start counterclockwise. Just make sure that you do both directions. This one is very global for the posterior side, anterior side of the knee. This will pump good blood and will prevent, most important, any deep vein thrombosis, any stagnant blood that starts to coagulate. We don't want that to travel and go to your lungs. So this is very proactive, good activity to do in the morning and to do at night. You want to use a towel or a t-shirt or some pants that are pajama pants, soft. Put it behind the knee and assist yourself and pull as much as you can from your biceps, your shoulders. Pull towards you. Assist your own bending of the leg as you're sliding your heel above the bed. Breathe through it. Maybe in the video's too fast. Take your own rhythm. Take your own time. The previous video showed how to do it assistive. This is fully active from the patient, fully stability from the hip. You notice how the knee isn't going to the left, going to the right. And when we activate, specifically in this exercise, the posterior side, the hamstring, we are inhibiting, turning off the quad, and thus allowing us to progress farther into the knee bending, the knee flexion. So when the client understands their neurology, they have better motivation to stay with the exercise program and supplement a lot better our PT sessions. Everything is done so eventually you can do this by the 3rd, 4th, or that's okay, even 5th week. This activity is by you pressing down on your heels, pressing and also using your upper extremity to press against the mattress. Stabilize yourself. If it feels comfortable with the elbows, fine. If you need to open up and put your arms and hands down, that's okay too. The video might be a little too fast, but this is now between 5 repetitions up to 15 repetitions. Do them slow so the back has time to adapt. Do this slow as you're seeing the knee coming up, initiating from the hip bending, flexion to be exact. Do between 5 to 10. If you're still early on this, use your hand to finish up the range of motion. If you're a particular hip patient, just be careful not to go above 90 degrees. You can go up to 90, but not beyond. Don't thrust it and force it. Again, I wanted to thank you. Wish you an excellent rest of the day. Win in the morning and closing out the day. And this is the recipe for success to supplement your home exercise, your episode, and your rehabilitation, habilitating you for the community intensities. Have a good day. Be well. Take care.